This message is brought to you by Prominence Medicare Advantage, proud sponsors of South Texas Multiple Sclerosis Council.
The future of the Valley, our future physicians are coming out of here. And so Dr. Soriano is one of those awesome ones. She spoke about shingles last month. It was a huge hit, so we had her come back, and she's going to talk about respiratory diseases today with a great presentation. So doctor, you want to come up?
The air we breathe contains oxygen and other gases, so the respiratory system's main job is to move fresh air into your body while removing waste gases. Every cell in your body needs oxygen to live. Once in the lungs, oxygen is moved into the bloodstream and carried through your body. The two most common chronic respiratory diseases are asthma and chronic obstructive pulmonary disease, COPD. However, they also include bronchiectasis bronchitis, pulmonary fibrosis, sarcoidosis, lung cancer, pneumonia, pulmonary edema, and influenza, also known as the flu.
And so the flu is a virus that has three main types that infect humans. And it's also, you get it through respiratory droplets, and it mutates every year, which is why we have a yearly recommended vaccine that we recommend for all of our patients, not just our older patients.
We do, once you, like the doctor was saying, that some of you chronic COPDers, asthma, when you're in the hospital, we do treat you with nebulizer treatments. How many of you have had a nebulizer treatment in the past?
Yo estaba diagnosed con asma en el año 87. Y es porque yo fumé 21 años. Y yo no sabía que era malo en ese tiempo. En ese tiempo cuando yo estaba fumando, when I was smoking for 21 years, era okay to smoke aquí, allá en el restaurante, en oficinas, con el doctor puedes fumar ahí. Yo creo que era bueno, porque todos estaban fumando. Pero no es bueno. Y ahora la vaping es más malo. Porque ese tiene químicas en la little maquinita.
They're diseases that essentially, and I'm sure you've had experience with this in the past, you have those breathing problems, you have a trigger, and all of a sudden you're having a hard time catching your breath, you're wheezing, and you're really feeling anxious. It's very common, yes. I'm seeing someone with their inhaler in the back. So, recommendations, kind of the recommended therapies are going to be to go see your doctor, because there's different classes of asthma, the same way that there's different kind of levels to COPD. And so depending on your level or your class, you'll have different recommended therapies. Kind of the base that we start off at is knowing what your triggers are and trying to avoid them. For example, if it's something like being around a cold or if it's exercise induced. And then kind of our basic entry level is our albuterol inhaler, which is a rescue inhaler for whenever someone is starting to have a flare-up or an exacerbation.
So basically what I'm talking about when we exercise is the lungs. Is you're going to take a slow deep breath. Fill up your lungs, hold it about 2 seconds, 1, 2, and then exhale. Oh, somebody just coughed. See how effective it is? So again, let's try it one more time. Slow deep breath, hold it, hold it, hold down.